Our next speaker is Vicky Whittemore, who spoke here last year. Vicky's from across the pond in Washington, United States, and does some sterling work there, which she's going to talk about. And she works for the National Institute of Health, which are a huge, huge enterprise in the States and extremely important. So we're very lucky to have you here, Vicky, and thanks for coming.
Thank you. And good morning, everyone, and it's wonderful to be back here again this year. And last year, for those of you who were here, I was able to talk about a lot of plans that we had, and I'm happy to say that this year I can talk about things that we're actually doing. So I'm representing the National Institute of Neurological Disorders and Stroke, where I'm a program director. But really, I'm representing our Trans-NIH working group on ME/CFS at NIH, and I'll talk about that a little bit more later. So NIH's mission is to seek fundamental knowledge about the nature and behavior of living systems and the application of that knowledge to enhance health, lengthen life, and reduce illness and disability. So in simpler language, what that means is we are funding research and stimulating and supporting research on everything from very basic science through translation to how can this be translated to individuals with diseases, and then moving on to those clinical trials and clinical implementation. So NIH is made up of 27 different institutes and centers. Each of them has a specific research agenda, very often focusing on a particular disease or body system. And I think, as I may have said last year, one of the difficult things about ME/CFS is that it didn't have one home, and it still doesn't have one home, but it has now 24 homes. So this is a picture of all of the different offices and centers within NIH. So like I said, I represent just one small piece of this pie, but now work across almost all of these institutes to really move ME/CFS research forward. And as I think many of you know from the press and from what's happened over the course of the last couple of years, is our director, the NIH director, Francis Collins, is unbelievably committed to ME/CFS research and has just been an amazing advocate for us throughout this process over the course of the last couple of years. So just to explain how NIH works as well, there are actually two major parts to NIH. There's the intramural research, which are the research laboratories and the clinical center that are physically housed on the NIH campus in Bethesda, Maryland, which is in this picture here. This is a picture of the clinical center, actually, and some of the other buildings. But there are also satellite labs in other parts of the United States as well. The extramural research, which is where I work, is research that's done by investigators located at institutions and academic centers throughout the United States. So it's money that we send out for grants throughout the United States and in some cases throughout the world. So to start with, the first thing that's happened at NIH is the intramural study on ME/CFS, and this was a study that Francis Collins asked be done, and it's being led by Dr. Avi Nath, who's the clinical director at NINDS, and these are studies that will be actually will be and are being conducted at the NIH Clinical Center. So they're recruiting 40 individuals with ME/CFS, 20 healthy controls, and as a comparator group, 20 individuals who have recovered from Lyme disease. And so the protocol on the first visit includes detailed phenotyping, so many tests, psychological tests, MRIs, tilt table, blood draws, so many, many different tests to really characterize the individual with ME/CFS. And then secondly, the second visit is to do exercise testing and evaluation of post-exertional malaise. So both healthy controls and study participants with ME/CFS have already been enrolled and completed visit 1. And so the visit 2 for some of these individuals will begin as soon as this summer and fall. So I recently had the opportunity to meet with and talk to Brian Vastag, who you see here on the tilt table, and also meeting with Francis Collins while he was there. Brian is an individual who has ME/CFS, worked initially at the National Cancer Institute in their Office of Communications at NIH, and then went on to become a reporter and a science journalist for the Washington Post until he became ill with ME/CFS. So he was recently there at the clinical center as a participant in the study, and just felt very thankful, I think, that he was able to participate in the study and that the study is going on. And it was really wonderful for me to get a chance to meet both Brian and Beth Mazer, who was there as well. So the other thing that they're doing in Intramural is they've organized seminars that meet sometimes monthly, about monthly or every 2 months, bringing in individuals to help to educate and provide perspective about various clinical and research issues associated with ME/CFS. And these are really good learning experiences for the intramural and extramural staff. Many of us go and participate in these seminars as well. And although we're relatively closely located within NIH, there's typically very little interaction between the extramural and intramural staff. And so it's really been a fabulous, I think, opportunity for us on the extramural side to really be involved and participate in their discussions on the intramural side. So as I said, we have a Trans-NIH working group that was revitalized in the fall of 2015. It's chaired by the director of my institute, not my institute, the institute I work in, the National Institute of Neurological Disorders and Stroke, and I help to coordinate the committee. And there, as I said, there's representatives from 24 institutes, offices, and centers across NIH who meet monthly and more often as we need to, who are now implementing our goals and strategies to stimulate and support research on ME/CFS. And I have to say, it's been one of the highlights of my career working with some of these individuals. We all come at ME/CFS with our different perspectives from neurology or immunology or muscular diseases. So it's really bringing all of that expertise together, and it's been a fabulous experience. So what have we accomplished? Well, first of all, one of the easiest, fastest ways for us to get money out the door was to provide 7 administrative supplement awards. And so what these are additional funds that we can award to individuals who already have NIH grants to enhance and bolster the research that they have ongoing. And so 2 of those went to investigators that I oversee their grants from NINDS, and 5 from the National Institute of Allergy and Infectious Disease, or NIAID. Last year when I was here, I announced that we had just issued a request for information, and I really have to thank many of you who were here because we got numerous responses from those of you here in the UK who heard me talk about that, and our communications office couldn't quite figure out why we were getting so many responses from England until I told them I was there and I asked them to write. So thank you, it was fantastic. And from that information, what we've been able to do is really get a broad understanding of the research priorities and the needs, not just from the research community and clinicians, but also from individuals with the disease and the caregivers, which has really given us, I think, a really, truly wonderful perspective. We've launched the Common Data Elements Project together with the Centers for Disease Control, and my colleague Beth Unger is here in the audience somewhere, and it's been really terrific to work together with her on that project. And many of the individuals who are working with us on this project are in the room as well, are the clinicians and researchers, as well as patient advocates who we've involved in this project. And I'll talk about this a little bit more in a minute. The other thing we've begun to do is to foster international discussion and collaboration. And so we've been in discussions with our colleagues in Canada who are going to move forward with funding mechanisms to join us in some of our collaborative research. And I'll come back to that in a minute as well. And hopefully we can join in with all of you on this side of the pond as well. So in terms of NIH funding, what we have the scientists actually accomplished, not us. And you can see that in fiscal year 16, there was a significant increase from around $6 million to now almost $8 million in research on ME/CFS. And that bar will go up even higher in this next year in fiscal year 17, actually, when we fund some of the new initiatives that I'm going to talk about as well. So we're absolutely going in the right direction, and I know we've got a long way to go to get to where we need to be, but we're definitely headed in the right direction. So the Common Data Elements Project is one of the things you just heard about is the need to standardize and harmonize. And one of the difficulties, if you look at the literature, the scientific literature in ME/CFS, is that studies are done using different ways to do the study, different ways to report the outcomes or reporting different outcomes. And so it becomes very difficult to compare a study where 20 individuals were studied in one place and 40 in another. And so what this is meant to be is a way in which you develop a common language, not necessarily restricting people to do research in one way, but really to report the research out in a standardized way so that we can really begin to do the big data, put together data sets so that we can really understand what's going on, not just in 20 people with ME/CFS or 40 people, but thousands of people. And so that's really our goal here. And we've divided the project into many different working groups focused on the various aspects, all related to ME/CFS. And so at the current time, where we're at is that have people, healthcare professionals, researchers, and ME/CFS stakeholders, so individuals with ME/CFS and advocates who are all involved in working in one or more of these working groups. And so they're working very hard now. Over the course of the summer, we'll be talking together, coming to consensus in each of these areas on what tests are being used, how are the outcomes reported. And in the fall, what we'll do is bring all of that information together, look at where there's overlap, and come up with a final document that then will be released to the public for public comment. And then we'll be able to implement that in studies going forward. Our big announcement came in January after a lot of work and a lot of discussion. We were able to release 2 funding opportunity announcements for multidisciplinary, multi-site ME/CFS collaborative research centers, and for 1 data management coordinating center that will work with those centers. So this is a collaborative effort between many different NIH institutes, offices, and centers. And our plan is to support $6 million in research per year for the next 5 years, and hopefully successfully after 5 years to keep that ongoing. And we really see this as just the beginning. It's a way to put research infrastructure in place in collaborative centers. So centers, not even necessarily all in one institution, but collaborative groups working together in what will be called a center, and what we kind of refer to as a center without walls. So bringing together the best researchers. And our plan is to fund 3 of these centers in the United States. Hopefully our friends in Canada will join in. And this will be a way in which we can really foster truly collaborative research in really critical areas of ME/CFS to move the research forward. Part of what we are hoping as well is that this will encourage young and new investigators to really be involved in the research and to help to grow a new pipeline of researchers as well in ME/CFS who will carry on the research going forward. One of the important things that we included in these centers is the requirement that they have community engagement and involvement to ensure success. So in each of the applications, they were required to indicate how they would involve individuals with ME/CFS and advocates in their planning and their activities going forward. So the overall research areas of interest that were stated in the funding announcements are that what we're hoping is that they'll determine the etiology and pathogenesis of ME/CFS, studies that will help to identify subtypes of ME/CFS based on biological markers or symptom classifications, longitudinal studies to better understand the course of disease over time, and develop and validate outcome measures for future intervention or clinical trials, and ultimately the identification of potential treatment targets for ME/CFS. So we don't expect to do clinical trials during this 5-year period, but that's our goal, is to really get to understanding what is causing this disease and what clinical trials can we move forward for better treatment modalities for ME/CFS. Our timeline is that the applications are now in, and I have to say we were absolutely thrilled with the number and quality of the applications we got in. When we were planning the funding announcements, there were people that were a little skeptical and said, do you think we'll get any quality applications? And I'm like, yes, we definitely will. And well, the community did us proud. So I think it's going to be a very difficult review. The applications will be reviewed in July, and our funding recommendations then will go to our advisory council in September with funding to begin, hopefully in September if we can get the money out the door. So that's our goal. From that, we plan to have a first meeting of all the investigators in early fall to really kick off the centers and get them to know each other, although many of them already know each other, I think, the investigators, but to really get them working together to go forward. So our plans, other than that, for 2017, as I said, launch our centers, complete the CDE project, and the other thing that we'll be launching is an interagency collaborative. So this is a committee working together to enhance our communication. So one of the things that we've realized over the course of the last year, we communicate very well within our own federal agencies, but we really want to enhance the discussion across the federal agencies in the United States and with our partners, hopefully in other countries like Canada and hopefully Europe as well, to really come together, develop research strategies and research priorities for ME/CFS that we can all work together on to advance the science. So our long-term goals haven't changed. To stimulate and support research on ME/CFS, grow the pipeline of investigators, support and expand ME/CFS research as funding allows, support the development of new therapies and treatments, support clinical trials for ME/CFS, and ultimately, and most importantly, to improve the quality of life for all individuals with ME/CFS. And with that, I'll stop and direct you to our website where we're trying to keep things posted and updated, and my email address for anyone who would like to contact me. I'd be happy to hear from you. So thank you again, and it's my great pleasure to be here with you all again this year. Thank you.
There's room just for some questions, I think. But you can see that, gosh, it's moving anyway. Things are beginning to happen now. Never fast enough. It should have always thought things in America happened yesterday, you know.
Not in the government, unfortunately. Yeah, there's a question in the back.
Yes, there's one at the back. Yes. Yes, please.
Well, first of all, as an American taxpayer, I'd like to say that Vicky's been one of my better spending projects.
Thank you, Deborah.
There's an issue that's been hanging out which is the question of the role of enterovirus. And I know you're nowhere near the pathogen point yet, but I mention it because Tony Komarov, Professor Komarov, who's one of the most long-standing and greatest epidemiologists and scholars of this subject, ME, and our great support, has said, to me anyway, that this is replicating prior experiments in enterovirus or researching the stomach tissues for enterovirus would be one of his top priorities if he had the money. And this is something that's hanging out there. I don't see anyone on earth talking about it except for John Chia, who works with it in Southern California. And NIH told him to get lost and don't come back with enteroviruses. And it's also very important because if you read about, well, they found a lot more of it when there were a few outbreaks. There is a lot of enterovirus around, Vincent Racaniello said. And also, the one possibility for polio going bad is that the oral virus could, the live virus could mate with an enterovirus. Anyway, so we have this terribly important issue that's going absolutely no place, that's invisible, unheard of. Where could that possibly fit in to your work or be brought into the light by your work? I mean, your NINDS and the
Yes, I think we've got the message. Thank you very, very much.
Yeah, so what I would say, my answer to that would be that I think our vision and our hope is that all avenues will be explored within the new collaborative centers so that we will begin to try to understand where that fits in the pathogenesis of ME/CFS, as well as infectious disease, as well as other kinds of things that may be at the root cause of ME/CFS. So I think that we will take that, I will take that back to the group, and as the centers are launched, we will discuss that as one of the research priorities within the centers. So thank you.
Okay, thank you very, very much. We'll come back to that, I'm sure. I was just going to say, Vicky, 10 years ago, I remember being told nobody ever applied with decent grant requests in this country or in the States. That's why there was no funding for it. I always thought it was nonsense then. And it's really nice to see that people now are getting encouraged to apply with bright ideas, radical thinking. And, that's what we're trying to do. And it's taken a long time, and I'm sorry for that, but, it's happening. Well done. Thank you very, very much. So come back with a checkbook next year again. Okay. Thank you very much.